Hey guys, welcome back to the Pre-High Performance Method YouTube channel. Today we're going to be looking at bunions or kind of foot deformities, how to really solve them or fix them, and also how to prevent them from even happening in the first place. Let's take a look. When looking at bunions, that's going to be where the toe starts curving in right there, which creates increased bone formation in that area where I'm pointing. This is just typically how bunions will present, and then that toe will curve in, creating more increased appearance of that toe right there. So a few causes of bunions, and then kind of how they can be prevented or even how they can be treated if you already have them. So when looking at your bunions, big thing that's going to be causing them is your footwear. So this is a type of shoe that may cause an increased bunions. As you can see, there's that curve, and the longest point of the shoe is actually in the middle of the foot, where my toe on the inside is actually going to be the longest point. So therefore, that curve and the reason that it's decreased length on that side causes the toe to move to the inside and increasing the chance of those bunions. So you really want something with a wider forefoot and a little bit more of a straight, so you don't get that curved in just like that. The other point that I want to make is the heel height right there is bigger than the front of the shoe. This means that your foot is going to be in a state of plantar flexion. So you're not getting into that max dorsiflexion that you need, which is that angle right there. This over time will cause an increase in ankle dorsiflexion. And when you go through areas where you need this dorsiflexion, your body will find a way to compensate. And typically, it'll do that by pronating the foot. And when the foot pronates, it'll also cause the toe to push inwards as so, which can be another cause of the bunions is a pronated foot or a constant flat foot. Pronation of the foot is normal, but a prolonged period is what would kind of cause that over time. So you really want something that can also allow your foot to move. So great toe mobility is also another key one, along with the ankle dorsiflexion. When you walk, you need a pretty good amount of that toe flexion. And if you don't get that, then right there, as you see, if you don't get that when you're walking, once again, your foot will curve in so that it can still walk normally, but not have to go through that wide range of motion because you don't have it available. And over time, that can result in bunions kind of forming, or even just overall toe and foot pain. This is a type of shoe that I would recommend you wear just for overall foot health, or if you do have bunions or you want to make sure you prevent them. You can see how it's more of a straight edge along there, and the longest part of the foot, the shoe, is the front, which is good for your toe. It's also more wide, so you have plenty of space for your toes to splay out. So there's not going to be really any cramping of the foot, no pushing that toe inwards. The other aspect is it's completely flat, so you're not going to be losing any of those mobility restrictions that we were talking about. You're going to have less arch in that shoe, so you're going to require your feet to work themselves, which is going to provide you with a nice strong foundation for that foot. We'll go over some exercises and things that you can work on to prevent bunions as well. If you do find that you're having to wear shoes that are maybe suboptimal, or even just if you want to keep your feet healthy, use something like these that are toe spacers. You can wear them if once you're done with work, you're at home, at night even. It just kind of helps spread out the toes again, especially if you have to keep your feet in crammed positions through your shoes. But I'd actually recommend wearing barefoot shoes as well as these toe spacers, especially if you already have bunions and you want to decrease them. This is the best way to start, is getting in good footwear and then getting the toe spacers. You can also work on ankle and toe mobility along with some other stuff, but the footwear and the toe spacers are going to be the best bang for your buck, especially early on with preventing bunions and also restoring your foot to its natural state. So one of the best ways that we're going to work on toe mobility is by just using our hand, and we're going to be bringing our toe up just as so, and then you're going to bring it up as far as you can, as far as your mobility allows, and then you're going to let go and try to hold it there. This is what we call a passive range hold. And then after 10 seconds, grab it again. Go back, try to hold it in place. This would be great to work on your passive toe extension as well as your active toe control. So doing that, holding the passive stretch, which is this portion, for about 5 seconds, letting go and trying to hold it there for another 5 to 10 seconds, and doing about 10 sets of that is what's really going to get the best bang for your buck on that one. The other toe control exercise that we do is here we're going to work on keeping the little toes down and lifting the big toes. So it's going to look like this. Do 10 of those, and then we're going to work on keeping the big toe down and lifting up the other toes. Same thing, we'll just do 10 of these. If you're not able to do this yet, what you can do is hold down, use your hands to hold down your toes, and then just lift your other ones, and vice versa. Use your fingers to hold down the small toes, and then lift the big toes. That can be a good start as well. Those are the two best things to work on your actual toe mobility. We'll go over the ankle stretching next. So what we're going to be doing for our ankle mobility is similar to the big toe. We're going to take our ankle, bring it into our max dorsiflexion, use our front of our shin muscles here, and then try to back up and try to keep our back of our foot as close to the shin as possible. Holding there 5 to 10 seconds, going back into that deep stretch, holding it there. Then once again, lifting up, trying to keep our shin as close to our foot as possible. And then down. And just doing about 10 reps of this as well. So guys, that about sums it up. If you guys want to prevent those bunions, definitely get into good shoes. So barefoot shoes preferably. Toe spacers daily. Really work on that big toe, ankle, and just overall foot mobility and control. You're gonna help prevent bunions, prevent foot problems. And if you already have bunions, those are also the steps you wanna take to getting rid of them or improving them so that they look better and have less pain and overall better function. So tune in next time, guys. We'll have some more good stuff for you. Please subscribe and let me know what you think.